Today we are going to discuss the triggers and causes of lupus and also the home remedies you can use to manage lupus flares at home. This week's video will continue where we left off last week. In case you have not watched the first video, you may want to watch that one first in order to get a better understanding of what is being discussed. Understanding the root causes will help you manage the causes rather than just symptoms. Please keep in mind that this is only an informative video, and that you should speak to your rheumatologist before commencing any treatment. Before we move on, if you haven't already subscribed to our channel, please hit the subscription button below to see more informative and health education videos on our channel. Now let's move on to our subject.
Causes of lupus. Despite the information that the underlying cause of lupus is unknown, a number of studies are showing there are triggers and causes that contribute to the development of this disease. Genetic studies, for example, have found that genetic factors are among them. One particular study conducted by Australians, published by Nature Today, April 27, 2022, researchers carried out whole genome sequencing on the DNA of a Spanish child named Gabriela, who was diagnosed with severe lupus at the age of 7 years old. It has been noted that such a severe case with early onset of symptoms is rare and indicates a single gene-related cause. In their genetic analysis, carried out at the Centre for Personalised Immunology at the Australian National University, the scientists found a single-point mutation in the TLR7 gene. They also identified other cases of severe lupus where this gene was also mutated. This study also shed light on why females are 10 times more likely to develop lupus than males. As TLR7 sits on the X chromosome, females have 2 copies of the gene while males have 1. Usually, one X chromosome is inactive in females, but in this section of the chromosome, silencing of the second copy is often defective. This means females with a mutation in this gene can have 2 functioning copies. From all these findings, we now know at least some risk of lupus is inherited from our parents. However, we also know that inheritance explains only a part of the risk of getting lupus. So other factors must contribute. There has been some evidence that emotional stress may contribute to lupus flare-ups or set off flare-ups, according to the Lupus Foundation of America and the Center for Disease Control, CDC. While stress does not directly cause lupus, environmental factors like stress play a role in the onset of the illness for individuals who are already predisposed. It has been reported that a new study has reviewed data that shows an association between trauma and PTSD and the occurrence of lupus in women. It found that PTSD was associated with a nearly 3-fold increase in risk of subsequently developing lupus. A past history of trauma, regardless of carrying a PTSD diagnosis, was associated with a similar 3-fold increase in the risk of lupus. 2. Viral infections. A long-standing study has implicated viruses as a causal factor in autoimmunity, and there are some studies that have demonstrated that viruses have the potential to play a role in either the induction or exacerbation of systemic lupus erythematosus, SLE, in genetically predisposed patients. Viruses that have been linked to lupus include cytomegalovirus, Epstein-Barr virus, which causes mononucleosis, varicella-zoster virus, which causes chickenpox and shingles. 3. Medication. Some medications, including certain drugs used to treat high blood pressure, hydralazine and diltiazem, used to treat high blood pressure or hypertension, procainamide, used to treat irregular heart rhythms, can increase the risk of developing lupus or trigger lupus symptoms. Other medications that have been shown to trigger lupus include isoniazid, an antibiotic commonly prescribed for the treatment of tuberculosis. 4. Pollutants and chemicals such as tobacco smoke and certain herbicides have been linked to an increased risk of lupus.
5. Some evidence shows that it is possible that COVID-19 infection may trigger the onset of lupus or cause a flare-up of the disease in people who already have lupus. However, more research is needed to understand and confirm the relationship between COVID-19 and lupus.
What are the vitamins and remedies to treat lupus? 1. Taking vitamin D, studies have shown that vitamin D can significantly reduce the symptoms of systemic lupus erythematosus and fatigue in patients suffering from this disease. Vitamin D deficiency and insufficiency are highly prevalent in patients with SLE, thus indicating a strong correlation between low levels of vitamin D and immune dysfunction observed in lupus patients. Vitamin D supplementation in lupus patients is recommended as increased vitamin D levels can reduce inflammatory markers and thus leading to potential clinical improvement. 2. Anti-inflammatory diet to heal the gut. An anti-inflammatory diet includes eating fish such as salmon, fruits and veggies, trying a handful of nuts like almonds and walnuts, and flaxseed seeds. 3. A leaky gut is linked with lupus. Most notably, a leaky gut promotes the production of anti-dsDNA autoantibodies and immune complex deposition, ultimately leading to lupus exacerbation. Taking regular probiotics, especially those with acidophilus, could help regulate your gut and increase your good bacteria, thus decreasing episodes of infections. Also, cut down on sugars and refined carbs. Evidence tells us that one of the causes of leaky gut is modern, processed food, especially sugar, refined carbohydrates and industrial fats. So advisable that the best diet for a leaky gut would exclude these foods. 4. Turmeric. You can take turmeric tea before going to bed. Turmeric acts similarly to steroid drugs. It can be used to combat inflammation and pain. 5. Apple cider vinegar. It has been seen that lupus patients suffer from a deficiency of hydrochloric acid, and one way of adding it to your body is by using apple cider vinegar. It increases hydrochloric acid production in the body, aids detoxification, and enhances nutrient absorption. You can put 3 to 4 spoons of apple cider in water and drink it. 5. Coconut oil. Coconut oil is beneficial to people with lupus. It has anti-inflammatory and healing properties which help to balance the immune system in a positive way. Thank you for watching. Please like, share and leave a comment down below. If you need us to cover any health topic of your choice, please leave a comment down below to suggest which topic you would like us to upload. For next week, viewers have already requested a topic, which is what are the common causes of migraine and how to cure it at home. Thank you once again and see you next time.